Hello, and welcome to Mental Health Matters. I'm your host, Courtney Gedeon, and today we are talking about perinatal mental health. The birth of a baby can trigger a jumble of powerful emotions, from excitement and joy to fear and anxiety. A certain level of anxiety when bringing home a new baby is normal, but the birth of a little one can also result in something you might not expect: postpartum depression, postpartum anxiety, and postpartum psychosis. Here to share her story of perinatal mental health is my first guest, Candace Thomas. Candace, thank you so much for being here today.
Thank you for having me, Courtney.
So this topic is near and dear to my heart. After I had my daughter, I experienced postpartum anxiety, something I certainly was not prepared for. So it's really great to have you on to share your story. So can you dive in and tell me a little bit about what was going on in that time of your life when you were having your children?
Well, I am someone that has struggled with anxiety for most of my life. So I would say that having children and experiencing postpartum depression and anxiety is a whole nother level of anxiety and depression. Nothing had prepared me for it in the beginning. I think I focused a lot of my time on the things that baby would need when baby was here. And when I had my first daughter, I had moved away from my hometown and all my friends and my family. I didn't know anyone here in Barrie, and it was very isolating. I didn't have anywhere to go, even if I wanted to. And meeting people for the first time with having a baby and trying to make friends as an adult was challenging, to say the least. I think that isolation really brought on a lot of my anxiety. And being a first-time mom, I didn't know what to ask for. I didn't know what questions I should be asking. And I think that kind of left me feeling like I wasn't a good mom because I didn't know what was happening to me. And I felt like if I expressed that, then someone would say, you're not a very good mom. And we all know what we're supposed to be doing. And so I kept to myself a lot. But having previous experience with anxiety, being on medication for my anxiety, I knew that what I was feeling wasn't normal. And I knew if I expressed it, that I would get help, and that would mean my daughter would get help. Now, fast forward to having my second, where I felt like I had all of these tools in my toolbox. It's the second time around. I got this. We were in the middle of a pandemic. I had my daughter July 17th, 2020, and it was probably the most isolating, anxiety-riddled experience of my life. I'm still trying to cope with that experience to this day. Yes. So yeah, that's a bit of my journey with the two daughters that I have, Olivia and Ada.
So your experience the second time around, although you thought that, I got this, I've had the first one, I know what I'm doing, you experienced a heightened anxiety almost with her. So things were still, there were still some postpartum challenges going on, but it sounds like it was worse with your second daughter.
Much worse. And with my second, it started well before I had her, because I was pregnant when the world shut down. Right. And it was almost an overwhelming amount of questions and concerns. And I had fatigue just from decision making. Should I get the vaccine, and will it harm baby? And what happens to baby if you get COVID? And the hospital restrictions kept changing. I didn't know if I would have my support person there or not. Yes. So it was a lot even before I had her.
So you were saying that, so before you've even had children, you were having some anxiety issues and whatnot. But what were your symptoms? Were they different when you had your children? And if so, how were they different?
I would say my anxiety before felt more like I would be very anxious about myself, my self-worth. I'm an overachiever. I want to work really hard. I think go is the way to be. Mm-hmm. What changed becoming a mom, my anxiety was, am I a good mom? Am I doing a good job? Am I keeping this baby safe? Am I doing the best job that I can? It turned from how can I make myself the best self versus how can I be the best mom that there is? And it's exhausting. It's really exhausting.
Right, exactly. I think part of it, and part of my experience too, was that we have this new baby. We're supposed to be feeling all this joy and all this sort of stuff. And I think, and tell me if this was your experience too, that when you're starting to feel maybe not those feelings, although I love my daughter more than anything, um, you're almost thinking about what's wrong with me? Why am I not feeling all of this joy that everybody says I'm supposed to be feeling? Was that your experience?
Yes. Well, you just said it right there. You said, well, I love my daughter. You see, we have to add that in so people know that it's okay to not be okay, but don't worry, I love my daughter. And I feel like it's just not fair because they put Olivia on my chest and I didn't feel anything. I felt okay, here she is. Now what?
Yeah.
And I know previous it was supposed to be these butterflies and rainbows or whatever was in the books I read. I don't know, but
Yeah.
I didn't feel those things. So from the first moment, I felt maybe there's a disconnect and maybe there's something wrong with me. So that was very challenging from that point on.
So when was it that you started to feel better? I know it was a bit of a different experience between your first and your second, but when did you start to feel a little bit better, and how did that process happen for you? What things did you do for yourself in order to get to a better place?
Um, I think I started feeling better when Ada turned 1. My second daughter turned 1. She was a bit more independent. Um, some restrictions had eased up. I could actually see people. I didn't have to stand at my window and talk to my parents through the glass anymore. Like it was just people, I got to be around people again, and the support was always there, but it felt like again I was having the support through the glass or over a phone or on FaceTime. Now having people around me, physically around me, and getting to talk to them, I felt more like myself. I'm a very people person, and
Mhm.
the community brought myself out again, I think.
Okay.
Mhm.
And did you seek any therapy or any like support groups or anything like that?
Yes. My first daughter, I went through the Barry Family Health Team, and
Okay.
I had access to all those resources. Again, you only get access to those resources if you are at the point of self-harm.
Right.
I think that's an issue again with our current system.
Yes.
Otherwise, the waiting list was a year long. With Ada, I had my own therapist. I would go see her, and it was fantastic.
Candace, we're going to have to stop you there because I do have to go to the commercial break, but we'll get more of your
Okay.
story in our third segment when we bring you back. More mental health matters when we return. Hello and welcome back to Mental Health Matters. I'm your host, Courtney Gedeon, and today we are talking about perinatal mental health. I am joined by the founders of the Canadian Perinatal Mental Health Collaborative, Patricia Tomasi and Jamie Charlebois. Ladies, thank you so much both for being here today.
Thanks for having us.
So I would love to know how the Canadian Perinatal Mental Health Collaboration began. This is a very near and dear topic to my heart. As you heard me talking with Candace, I experienced quite severe postpartum anxiety. But Patricia, I guess we'll start with you. Can you tell me how this all evolved and how it began?
Sure. So, like you and like many women and men and birthing persons across Canada, Jamie and I both struggled with different facets of perinatal mental illness. I'm sure your viewers have maybe heard of postpartum depression, maybe have heard of postpartum anxiety, like you mentioned, but there's a whole spectrum of illnesses that, Jamie is the medical expert, and she can tell you more about that. But how we got together, how we formed the CPMHC, or the Canadian Perinatal Mental Health Collaborative, it's quite serendipitous, actually, and a really great story. As I said, we both have lived experience, Jamie and we both live a couple kilometers away from each other, but didn't know each other. And I was writing, I'm a former journalist. I was writing for HuffPost Canada when it existed on maternal mental health and the state of, at the time, what I was calling maternal mental health. We call it perinatal mental health now because it affects dads as well and birthing persons. So one day I interviewed a lovely, wonderful expert called Jamie Charlebois, who's the perinatal mood disorder coordinator for our area. And that's when we discovered we lived just a couple kilometers apart. And then we kept bumping into each other everywhere in town. You know, that you come across a word or someone and then you just like hear that song all the time, or
That's
so we just
right.
started seeing each other in the grocery store, and we going out for coffee and talking about this mutual passion that we had for perinatal mental health, and saying, where are the advocates? We know, like, we had trouble navigating the system. Where are the advocates that we can help? And we couldn't find them. So we just turned to each other and said, oh my God, are we doing this? Are we going to start this? And so naively one night at a cafe, not knowing everything that would go into it, but we love all the work that we're doing. We started the Canadian Perinatal Mental Health Collaborative, and that was the fall of 2019.
Wow. Well, I mean, it's amazing. I'm so glad that you guys are starting this. It's so important. So thank you for advocating for all those parents who go through a challenging time. And I would like to understand, I guess, Jamie, I'll ask you this question. What would be the difference between, let's say, baby blues and postpartum depression?
So baby blues is part of a normal emotional transition that occurs after having a baby. So after the birth, this signals changes in our hormone levels, and we may have feelings where we're happy one moment and sad the next, and we kind of emotionally go up and down, but the general overall feeling is happiness. And so that would be what we call the baby blues. When people start to feel low, and that goes for more than 2 weeks, then we're looking at something more diagnosable like postpartum depression or postpartum anxiety, which we are seeing at much higher rates nowadays. And so you may hear some people like, oh yeah, I had the postpartum, but it was like 6 months later. And it's like, okay, or I had baby blues for like a year. And you're like, no, that wasn't baby blues. That was something a lot more severe. And for some people, it will go away on its own. But for other people, it does require intervention or treatment. And whether that is, from a physician or with a therapist or with medication.
Okay. And so in terms of the statistics, do you know what the numbers would be in terms of how many women will have postpartum depression or postpartum anxiety? Can you explain that a little bit?
Yeah, so pre-pandemic, we were seeing rates of about 1 in 5 or 20%, but actually in our region, rates are much higher, like almost 27%. During the pandemic, rates have at least doubled, and some will say tripled, due to isolation, changes in services and access to those services. Early on, child and family centers, where we typically send moms and dads to socialize, have been closed. And so even before the pandemic, we didn't have good resources. And through the pandemic, we have asked parents to do things in isolation without their support systems.
Right. And that was going to be one of my questions, is what contributes to postpartum depression? And it sounds like isolation is a big factor.
It certainly can be, but it's, a biological, a sociological, and a psychological issue. So there are genetics that are strongly related. So if you have a family history, there's your environment, your culture, and then there is, different hormonal and different processes that can occur. So it's really explicit, and there are many risk factors also.
Okay. So I guess my question is, and maybe Patricia, I'll ask you this question. Why don't people talk about postpartum anxiety and postpartum psychosis? Because I had a doula, I had a midwife, all of that sort of things. And I went to the classes that you go to, the prenatal classes and all that sort of stuff. They touched on maybe postpartum depression, but nobody mentioned anything else. Why does this happen?
Well, I think two reasons. Number one, a lack of knowledge. There's not even adequate training for, primary healthcare physicians. So unless, a doula or a midwife or a doctor takes it upon themselves to do the training, they really only have, I guess, very surface knowledge. And that's why a lot of healthcare practitioners don't feel comfortable asking how a new mom or dad or birthing person is doing. The second reason, stigma. We've still got a lot of stigma because of this myth of motherhood. And, we all know about it. We all know about the moms who post on Instagram. I mean, we're all guilty of it too. Of course, we want to portray happiness and we don't want to put sad posts up all the time, right? But there's that, and then there's also this myth of the blissful motherhood, just like Candace was saying. Like they put the baby on her chest and she's like, what? She's like we're supposed to hear angels singing,
Yes.
Motherhood is hard. It's so hard. And I just think the more we talk about it, like this, like you having us on your show, which I think is phenomenal, the more we raise awareness with the work that we're doing. We're running a walk that we'd love to talk about soon with you,
Yes.
called Flora's Walk for Perinatal Mental Health, from now till May 4th. You can sign up on our website. I mean, the more we talk about it, the more we change the system, things will start to change. And you'll get
Right.
those prenatal classes where you'll talk about all of it.
I hope so. I really hope so. And I hope what they also talk about is the fact that it's not just women who can experience. I guess maybe I'll ask Jamie this question. Let's talk about fathers. Let's talk about what they're going through, because that's new information to me.
So we see, 1 in 10 dads, and probably that statistic has increased during the pandemic also. But, the old kind of thought that, well, they are not going through pregnancy and birth, so they can't get it. But the reality is they're going through a transition, their hormones are changing, and their situation and the dynamic between them and their partner are changing. And women do have some hormonal ability to adapt to decreased sleep, but partners don't. So partners are lost in the system because there are absolutely maybe 2 supports in Toronto for that.
Wow. Well, there's so much we can learn. You guys are a wealth of information. Thank you so much. We will be bringing you back, and don't go away. More Mental Health Matters when we return. Hello, and welcome back to Mental Health Matters. I'm your host, Courtney Gedeon, and today we are talking about perinatal mental health. I am joined by my wonderful guests from the Canadian Perinatal Mental Health Collaborative. Thank you so much for being here, and Candace, thank you so much for sharing your story with us today too. It's so important.
Thank you.
So Candace, I do want to ask, how was the CPMHC part of your healing journey?
To be honest, I would say the biggest part is that they gave me hope. They gave me resources and guidance and a community. And it made me feel like I was never alone at any point, because I could relate to them and they could relate to me, and they gave me purpose and meaningful drive to make change for people that are like me and like us, really.
Yes, exactly. Well, it sounds like from what you were saying before, part of the, contributing factors was that you felt that isolation. And it
Yes.
sounds like it gave you a community where they got what you were going through.
Yes, definitely. Patricia and I, same thing, very serendipitous. I used to walk by her on my way doing massage in the workplace at the Lynn, and I saw her all the time. And same thing, she never knew my story. I never knew her story. And then we just collided. And when she asked me to be the social media ambassador, I was well on board. So I'm happy to share what they're doing.
Can I just say, Candace is a rock star at social media. This happens a lot. You go through it and that's when you learn for the first time that there are elements missing in the system to help for perinatal mental health. And then you get through it and then you're like, oh my God, I got to do something about this. And you turn into what's called a warrior mom. Well,
Yes.
Candace is a warrior mom, and her TikToks and reels are, I don't know what the cool kids are saying these days. The bomb, rad, hot,
Yeah,
So cool.
thick.
So
I don't
cool.
know. But
You know
she
what?
is great.
I was going to mention that. Candace, I really love your Instagram page. I find it so positive, and I love everything that you do on there. So we will make sure to get your handle so people can follow you after this. But I also wanted to ask, Patricia, you were mentioning about a walk that you guys are hosting, and I would really love to know a little bit more in depth about that.
Mhm. So our walk is named after a woman from Toronto named Flora Babakani. It's a very tragic story. Flora, and just a little trigger warning here. I'm going to talk about something that might upset some people. It is about suicide. So if you want to leave the room, you can. So Flora had her baby on November the 4th of 2021. She it was her dream, her lifelong dream to have a baby. She was 44, went through IVF treatments, fertility treatments, finally got pregnant. So happy. Her friends and family rallied around her. Unfortunately, she started to develop postpartum, severe postpartum anxiety, and then postpartum psychosis. And so postpartum psychosis and postpartum bipolar disorder really quickly is rare. It's 1 to 2 in 1,000. So when we talk about postpartum depression, you hear in the news maybe of a mom taking her life or harming her children. That is very rare. We want to make that clear. But tragically, this happens, and she could have gotten help. The red flags were all there. Unfortunately, the system didn't come through for her in time, and she died by suicide on January the 14th of 2022. So we started Flora's Walk for Perinatal Mental Health. It's happening on May the 4th, World Maternal Mental Health Day. You can sign up now, start an individual walk, or join a team and walk in any city across Canada on May the 4th.
I think that's so amazing that you're doing that. Yeah, that story really hit me. And one of the things that I used to do was walk when I was trying to feel better. So I know how important that is. And so I'm really glad that you guys are doing that, also to help bring awareness, of course.
Yeah, and we'll be donating the proceeds to Flora's baby Amber, who is going to be adopted by Flora's sister, and also to continue our work to
Wow,
improve perinatal mental health services in Canada.
that's amazing. So quickly, Jamie, can you tell me a little bit about the certificate program that you guys offer there?
So we personally don't offer education and training. That's through the Canadian Perinatal Mental Health Training or through Postpartum Support International. But these two organizations are training our healthcare providers, social service workers, therapists within the communities so that they have the skills to appropriately assess, diagnose, and treat to remission. And the more people we have trained, the better care people are going to receive. So we don't quite have the system in place to treat everybody appropriately yet, but it's coming. And the more we talk about it, the more awareness we bring, the better outcomes that we will have as Canadians.
We are now on the government's agenda. So we're working with the federal government to bring timely access to perinatal mental health services.
We do have to wrap up, ladies. You are so amazing, all of you. We will make sure that we post where to get in touch with you. Thank you so much for being here today. And thank you for watching at home. This is Mental Health Matters. I'm your host, Courtney Gedeon.